Hi, Mr. Matthews. I'm
Hi.
Stephanie. I'm a pharmacy student at UVille. Just want to take a couple minutes out of your time to just go over your new prescription. It just take about 5 minutes. Is that okay?
Yeah.
Okay. So I just want to go over some of your information. You still live at 123 whatever Avenue,
Yep.
and your number is 1234567.
Yep.
And you're allergic to NSAIDs.
Yep.
And your doctor prescribed you on Lexapro. Do you know why you're on the Lexapro?
To make me less sad.
Less sad. Why are you sad? Do you want to talk about it or?
Just school.
Just school? Yeah. I see that you're in pharmacy school. I know it can be a little difficult. We're going to try to make you feel better. Your dose, your doctor put you on a 10 milligram dose that you're going to take once a day. You can take the medication anytime during the day. You don't have to take it with food. You do want to take the medication about the same time every day. If you do miss a dose, if it's close to your next dose, you can just forget about it and then just take the next dose. But if it's pretty early on, you can take it when you remember. There are some side effects to the Lexapro. You can feel nausea, diarrhea, upset stomach. You can have an increased appetite. These are not very common side effects, but they can happen. Any interactions you want to wash out about is you really don't want to drink any alcohol with the Lexapro. It can make you feel very drowsy. Okay? So if you could just go over what I went over with you, how to take your medication, so I know I explained it well to you.
Okay, I'm going to take it. Doesn't matter if I take it with food or not. And I could feel nauseous. And I should not drink while I'm on it.
Right. And as far as storing your medication, you do want to keep it in a cool, dry place. You don't want to keep it near heat or moisture, so the bathroom probably isn't a good idea. And again, you really don't want to drink alcohol with the prescription. So I'm going to give you the prescription, and then you're all set.
Okay. Thanks. Hi, Miss Harold. I'm Lucas Regulin. I'm
Hi.
a student pharmacist at Duville College. And I was just wondering if I could talk to you for about 5 minutes to discuss your husband's medication,
Sure.
just to make sure you get the best results from that.
Mhm.
All right. And just wanted to make sure I have your info correct here. You're still living at 1234 Main Street?
Yeah.
All right. And your phone number is still 1234567.
Mm-hmm.
All right. So your doctor is prescribed Norman generic atenolol. And I'm just this is really important. I was wondering if you could possibly put down the phone for like 5 minutes. I just want to make sure your
Sure.
husband can get the
Okay.
best treatment possible.
Sorry.
No, you're fine. I just want to make sure, it's important. Just want you to get it all. And do you know why your doctor has prescribed this for your husband?
No.
Basically, he's had high blood pressure the past couple months, and this is very common and easily treatable, but dangerous if left untreated. So this is why you're here.
Okay.
This medication, if taken properly, along with his diet and exercise, will slow his heart rate and relax his blood vessels, which lets the heart work less, and so it's not overworked and his heart stays strong. Basically, that's why he's going to be taking it. And these are 50 milligram pills, and he's just going to take one a day, and it doesn't matter when he takes it.
Okay.
He just wants to get into a schedule to remember to take it at the same time every day.
Mm-hmm.
And it doesn't matter if he takes it with or without food.
Okay.
All right. And does that make sense?
Yeah.
All right. Most people won't experience any lasting side effects, but a few of the common ones they'll experience the first week or two is tiredness and nausea.
Mm-hmm.
If these are extremely persistent or bad, then call your doctor or myself, and we can probably change medications for him, something that works better. Potential interactions with this. It doesn't say he's anything on either of these. Coreg or Norvasac, calcium channel blockers or alpha blockers.
Mhm.
It says he's not on it. I just want to make sure you guys aren't at another pharmacy because these could be dangerous.
Okay.
And if he forgets to take a dose, just tell him to say he takes in the morning. If he just remembers at lunch, that's fine. Just take it then.
Okay.
But if he remembers like the next day, just skip it. Don't ever double up on a dose. Just take the next regular dose and just take an extra day of the month. And just keep it in this container that I give you in, and just keep it away from children and heat and moisture. So that's about it for that. So just to clarify, how are you going to tell him to take this medication?
Once a day, whenever he wants, but try to keep it on the same schedule.
Yep, correct.
Mm-hmm. I think that's about it.
Yep, might feel a little tired, but that's
Okay.
about it. That should go away. And so for that first week, don't do anything like don't drive around while he's real tired if he is,
Okay.
because you don't want him getting in an accident or something.
Yeah.
If you forget any of this, telling him, or have any questions, just feel free to call me here. And thank you for your time.
All right, thank you. Hi, are you here to pick up a prescription?
Yes, I am.
What is your name?
Mary Smith.
Okay. Hi, I'm
Hi.
Christine. I'm a Dewville School of Pharmacy student, and I would just like to take a few minutes. I noticed this was new for you, to go over this so you get the best effectiveness from the medication. Is that okay?
Yeah, that's fine.
Okay, great. So I just wanted to confirm a few things before we started. You still live at 123 Main,
Yep.
and your phone number is still 1234567.
Yes.
Great, perfect. So you are being prescribed lovastatin. This is to help lower your cholesterol. I guess your doctor took a blood sample and found your cholesterol to be high?
Yes, I think so, yeah.
Okay, great. Did he tell you how to take this medication?
No, he didn't.
No, okay. So you're going to take one a day. It's best to take this at night. For some reason, cholesterol levels are higher at night. When you're sleeping, they rise. So it's better to take this at night. Did your doctor tell you any side effects to expect from this?
No, he really didn't tell me anything.
Okay. The most common side effects are nausea, maybe some diarrhea. Nothing really extreme from this. If you get any sort of muscle pain or pain that you shouldn't get from your daily activities, then you should call your doctor, definitely, if you experience any sort of muscle pain. Did your doctor tell you about any other potential warnings or side effects?
No, not really.
Okay. I just want to make you aware that grapefruit juice interacts with this medication, so just to avoid any sort of grapefruit or grapefruit juice. Do you like grapefruits?
Yeah, a little bit.
A little bit? Okay. So when you're taking this, just try to avoid them. If you want to have a little bit of juice, that's fine. Just space it away from the tablet, but don't eat them every day.
Okay.
Try to avoid it as best as possible. If you miss a dose of this and you remember soon after you miss the dose, take the dose. If you miss the dose and it's close to your next dose, just skip that and continue on with your dosing regimen of one a day. And to store this medication, you just want to keep it away from moisture and heat. So the bathroom is probably not the best place, and direct sun is not the best place. Maybe just on the counter, away from windows. Do you have any questions?
Nope, I think I'm good.
Okay. Just to make sure I'm clear, can you just go over how you're going to take this medication?
I'm going to take it once a day. And if I miss a dose, if I remember it, take it as soon as I remember it. But if it's too close to my next dose, just skip it and then take the next dose.
And try to take it at night right before you go to bed. If also avoid grapefruit. Grapefruit juice and grapefruit. And if you have any questions, you can call me here at the pharmacy. Again, my name is Christine.